We have a new sheriff in town in terms of all things Medicare. Dr. Oz was approved to be the boss of CMS, the Center for Medicare and Medicaid Services. So that pretty much includes Medicare, Medicaid, the Affordable Care Act, Marketplace Insurance, Obamacare, whatever you want to call it. So he's in charge of all of it. So today we're going to talk about that, not the Affordable Care Act part, but we're going to talk about predominantly Medicare and what this means for your Medicare plan going forward. Talking Medicare Advantage plan, Medicare Supplement plan, Medicare Part A, Part B, drug plan, and we're also going to get into Medicaid here first. This is also a live Q&A. Looks like I already got a ton of questions here, and so this entire video will last about an hour. If you're watching this on a recording, you don't have to watch the whole hour to get the Medicare part. I'll talk about the Medicare part for about 10 or 15 minutes, and then I'll get into all of the questions that people have typed in. So if you're watching this on a recording, make sure you subscribe, like, and share, and that way you can find us in the future if you do have any questions. Okay, so let's talk about Medicaid. He was asked a few times about Medicaid. What are you going to do with Medicaid? And he says, he's going to he thinks Medicaid is a phenomenal thing, and he kind of played politics with it. He didn't say whether he was going to cut it or not cut it or whatever the case may be. So he kind of played politics and didn't really answer the question. One of the things that he did say, and the people in charge, the Doge people in charge of all of this, are that they are going to, there is fraud, waste, and abuse in Medicaid, quite a bit of fraud, waste, and abuse. And for those that don't know the difference between Medicare and Medicaid, Medicare, that's the one with all the letters, the Part A and the Part B and the Part C and the Part D and the Medicare Advantage plans and the Medicare Supplement plans. Medicare is the one you sign up for at the Social Security Administration. So Medicare is the one you pay FICA taxes on for all those decades. So when you pay FICA taxes out of your Social Security check or out of your regular W-2 wages, you'll see FICA and it'll say Social Security wages and then FICA Medicare. So FICA for Social Security, you pay 6.2%. FICA for Medicare, you pay 1.45%. And then your employer pays another. If you make over $250,000, you do pay a little bit more Medicare as a percentage as well. But so Medicare, that's the one you sign up for Social Security at 65 or being on disability after 2 years. Medicaid is administered by the states. It's a kind of, federalism type system where the federal government and the states kind of coordinate and fund, but it's actually you sign up for Medicaid at your state. The Medicaid office, Department of Welfare, Department of Social Services, whatever the case is in your particular state, that's where you sign up. Some states call Medicaid something different, like California calls it Medi-Cal, medical, but with a little dash in there. California, they always got to be original, but some states call it different. So in order to get Medicaid, you have to have low income, low resources. Medicaid is a welfare-based program. There's millions and millions of people on Medicaid throughout the world, throughout the country, and you get it low income, low resource. Disabled people can get Medicaid. You can have Medicare and Medicaid at the same time. There are millions of people that have Medicare and Medicaid. So they are eligible for Medicare. They're receiving, based on, being disabled for 2 years or being 65 years old. They're getting a Social Security check and they're getting other income or no other income, but their resources are low enough. Their income is low enough that they're also eligible for Medicaid. So they get Medicare and Medicaid. It is possible to get both. And if you're lucky, I guess not lucky, but if you're low income, low resource, Medicaid will pay for your Part B premium. This is a thing that a lot of people miss out there. The Part B premium this year is $185. A lot of people can't afford that. If you can't afford it, if you know somebody that's having a hard time paying that $185, tell them to apply for Medicaid before, all the big changes here. Tell them to reach out, run, don't walk, and apply for Medicaid. And if they approve you, then you'll get a lot of other benefits and you'll save a lot of money in terms of your health care. And if you're approved at the higher levels of Medicaid, QMB or SlimB or QI, depends on your particular state, then you will get your Medicare Part B paid for. So that's an extra $185 in your pocket. And so you're dual eligible, Medicare and Medicaid. So make sure, so the people out there watching this, and it doesn't apply to me. I'm sure there's someone in your area that family, friends, or relatives that might apply to you. So make sure you share this information. But if you're getting Medicare and Medicaid, you're dual eligible. And then there's Medicare Advantage plans that might help you get you some extra money and some extra dental, vision, hearing, and some extra benefits. So you can definitely check out that. And, all of my live Q&A is sponsored by Chapters, so you can reach out to them and they can help you and see what's available in your area. Okay, that's the Medicare Savings Plan. So Medicaid, one of the things that Dr. Oz is talking about, it's not started yet, but they, we're talking about Medicaid cuts and not cuts, but attacking fraud, but kind of throwing the baby out with the bathwater. It's kind of the same type of thing that's going on with Social Security. They're saying, oh, there's millions of people, deceased people receiving benefits. They weren't, and now that they figured that out, now they're moving on to their next chestnut of, oh, it's all immigrants' fault, and people that are non-citizen getting Social Security cards. Even Elon Musk, even though Elon Musk was a non-citizen getting a Social Security card, and the guy going out there on all the news channels, oh my gosh, I'm so shocked that non-citizens get Social Security cards, but when all his relatives, his brothers and sisters and mother and father were all non-citizens getting Social Security cards. So yeah, I'm not sure how, he's clutching his pearls. So anyway, so the Medicaid, they're talking about work requirements. Again, this hasn't been instituted yet, but and this is the strange part, is that a majority of people that are on Medicaid are already working, but private companies pay so terrible in terms of pay. They essentially, the private companies are getting kind of welfare, indirectly. So a private company, if they paid person, enough to live on and pay for health care and pay for food and stuff like that, the people that were working at those companies wouldn't have to go on to, a welfare-based program like Medicaid or food stamps or something like that. So it's essentially, it's indirect kind of corporate welfare, if you ask me. But anyway, nobody's asking me, right? Anyway, so you can file for that Medicaid, but if they start doing the work requirements, then most people are good because they're already working. And the people, and a lot of people that are on Medicaid are elderly or disabled. Again, if you're receiving Social Security disability insurance, you can get, Medicare, but people that are not qualified for SSDI may be qualified for SSI. And SSI is the Supplemental Security Income. That's the welfare-based program the Social Security Administration administers. SSI. SSI is not SSA. Everybody always messes that up. SSI is Supplemental Security Income. It's a welfare-based program, low income, low resources. You get SSI based on being disabled or elderly, 65 and older. But that is administered by the Social Security Administration, and it doesn't come out of the trust fund. That comes out of regular general taxation. Okay, so Medicaid. So I'm going to keep an eye on all this and the work requirements and everything, and the cuts. And hopefully, there's no cuts to the Medicare Savings Program, because a lot of people probably watching this are getting their Medicare Part B paid for by Medicaid. And if Medicaid starts getting cutbacks, then you're going to have to shell out the $185 yourself. So, and unfortunately, cutting Medicaid like that and then not being able to pay the $185 for a lot of people, those people are going to say, well, I can't afford Medicare anymore, and they won't pay for the Medicare Part B, and they'll have no health insurance. And we're going to go back to the way it was years ago, where the primary health care for everybody was the emergency room. And yeah, hopefully we don't return to those dark ages. All right. So what about Medicare Advantage itself? Well, if you ever watch Dr. Oz's show, that he is a big fan of Medicare Advantage plans. Those are the ones, that's Part C of Medicare. I don't like it being called Part C, because these are private companies. It makes it sound like it's part of, the government Medicare. Medicare Advantage are private companies that, so you don't sign up at Social Security for a Medicare Advantage plan. And these are private companies, and they have networks, and they have the prior authorizations. Everybody's heard about all of these issues in the news recently. And Dr. Oz is a big fan of those. He's, kind of sold those on his show. And Medicare Advantage, he has a proposal that Medicare Advantage for all, so that his universal Medicare for all program would be under the umbrella perhaps of Medicare Advantage. So they have been talking about making Medicare Advantage plans kind of the default option. So when turn 65 years old, you're automatically signed up for some Medicare Advantage plan. That's what they're talking about. Again, I'm going to keep an eye on that and keep you all up to date on all of those type of changes. But Medicare, one of the other things he's talking about is Medicare billing, and these Medicare Advantage plans, double billing, and up charging for things, making tons of money doing that. And so he said he's going to go after that, which is a beautiful thing. We always like getting rid of fraud, waste, and abuse. But some of these companies, it really depends how it's done. So some of these companies might, react and says, hey, we were making all this tons of money, doing things maybe not correctly, but we were making tons of money. And because we were making tons of money, we were able to provide all of these bells and whistles in our Medicare Advantage plans, all the extra, dental, vision, and hearing, and transportation, and grocery cards and stuff like that. So if there's changes that are made for Medicare Advantage payment by the government, because those plans, when you sign up for a Medicare Advantage plan, basically that company, whoever you sign up for, their lobbyist then goes down to Washington, D.C. and says, hey, I just signed up John Smith. Give us a whole bunch of the money that person paid into Medicare all of those decades. And that's what they do. They pay the Medicare Advantage plan a yearly kind of a amount, as long as you're signed up for that plan. So that's how they're able to get those zero premium plans. Is you've already paid for it, so you've prepaid for your Medicare Advantage plan. But if they start squeezing these Medicare Advantage plans, then they're going to start pulling that stuff back and making more prior authorizations, possibly reducing networks. So we're going to see a lot of changes probably this year. There was a bunch of changes for 2025 for Medicare Advantage plans, and that's why I recommended, during the 2025, changeover last October, November, December, I recommended everybody review their plans, because there was a bunch of plans for 2025, probably the biggest disruption in the last 20 years because of the Part D changes, negotiating with drug prices and everything. So 2026 might be as crazy as well, if not more, but we'll keep an eye on that and keep you up to date. But if for right now, if you have a Medicare Advantage plan, you really can't change it unless you've recently moved. If you're new to Medicare, you just got disability after 24 months, you're just 65, you're turning 65, you recently lost your health insurance from work, or you're about to lose your health insurance from work, then make sure you check out, get signed up for Part A, Part B, and always, 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 always review Medicare supplement plans first. Regular viewers to my channel know I always recommend Medicare supplement plans first, the Plan N or the Plan G. Those are the ones that are available for most people right now. And then they got the high deductible versions. But if you get a Medicare supplement plan, then you don't have any networks. You can use any doctor, hospital, clinic in the country that takes Medicare, no networks. And you don't have to have prior authorizations. If your doctor says you need it, it's medically necessary, you're done. You don't have a health insurance company second guessing. But there is a monthly premium for those. Freedom comes with a cost. But check those plans out. So if you're about to sign up for Part A, Part B, call Chapter. They can help you out, 100% free. They're going to be closed for the next couple of 3 days because of training, but call them at the end of the week and they'll be there. So we're talking about April 7th, 8th, and 9th. They're going to be on a training retreat. So The Medicare supplement plans, check those plans out first, and if it's not for you because of a, premium, the premium issue, your budget issue, then fine, then go to a Medicare Advantage plan. But always, anybody that ever helps you with a Medicare, plan when you turn 65 or whatever, always ask them, okay, all right, I know you make more money on a Medicare Advantage plan, buddy, but tell me about Medicare supplements first. And if it's not right for you, then it's not right for you. All right, Part D drugs. And Dr. Oz was saying that he likes the fact that the government is finally able to negotiate drug prices, which is, it's always amazing that the government, Medicare, was not able. Well, I misspoke. The government was able to negotiate drug prices. The Veterans Administration, Veterans Affairs could negotiate drug prices. But for some reason, well, I know the reason. Medicare wasn't able to negotiate drug prices. Why wasn't Medicare able to negotiate drug prices? Because the pharmaceutical companies have phenomenal deep pockets and awesome lobbyists. And so, but now finally, they're negotiating drug prices, and the first 10 have already started. So he said he's going to protect that. Another thing, there's changes on these weight loss, aka diabetes, Ozempic and different things like that. So there's changes there as well. So there's going to be a lot of changes. That's the great thing about Chapter. If you call them up, if you're one of their clients and you have any issues like that, it says, hey, are they going to stop doing this? And I got this weird bill and I need to find a new doctor. They're one of the only organizations that have a really, really good after service, a member success team that can help you out. So that's one of the reasons my son and I chose them to help you all out. All right, so Medicare supplements, no changes for Medicare supplement plans. That's the great thing about Medicare supplement plans. Once you sign up for a Medicare supplement plan, you're good. Most people keep a Medicare supplement plans for decades. No prior authorizations, no networks. But Medicare supplement plans, you can change any time of the year if you want to see if you can find a better one. Not they're all the same, but a cheaper one. Cheaper is better, better is cheaper. Anyway, so if you have company X, Y, and Z, and you want to see if you can save some money every month, call up Chapter or whoever signed you up for that and say, hey, you might have to go through health underwriting depending on your particular state. So if you're young, healthy-ish, 65, 70, 75, 80, and healthy, you just might be able to switch to another plan. And so the health underwriting is pretty easy. You just call Chapter, whoever, and they ask you like 20 or 30 questions. And if you answer no to most of those questions, you pass the health underwriting. So it's pretty easy. It only takes about 30, 40 minutes or so to do that. So, and you can do that 365 days of the year, change your Medicare supplement plans, change to a cheaper one if you can find it, change from an N to a G or a G to an N or whatever. Medicare Advantage plans, the next general change is starting October 15th. But again, if you move or you're new to Medicare or anything like that, you can change. Part D, same type of thing. If you move or anything, you can change it. And there's all kinds of special. If you're receiving Medicaid, you lose Medicaid, you can change your plan. If you're gaining Medicaid, you can change your plan. So yeah, there's all kinds of crazy, things times you can change, a special enrollment periods and the initial enrollment period. And yeah, it's kind of crazy. All right. So that's why I, got Chapter to help you out there. Okay. All right. So, if you have any other questions on any of that, I'd be happy to help you out. Let's see. Jack asked, let's move into the Q&A. Jack Feathers, please explain, doctor, what I could do for Medicare. I pay over $500 now to have Medicare medical and pharmaceutical coverage. I have B. Okay. So it sounds like if you're paying $500, you probably have part, A and B, and then you're probably get a Medicare supplement plan. Those are the ones with the monthly premium. You're probably receiving the old F. Those are getting kind of expensive, and you have that. The Dr. Oz, pharmaceutical coverage, that's might affect you going forward. If you have a Medicare supplement plan, again, you should be good, unless they change the whole industry. And, because all these companies make more money doing a Medicare Advantage plan. And that's a kind of insider trick that you need to watch out for. Lori, I'll get to your question here in a second, but here's an insider trick that you need to watch out for. If you sign up for a Medicare supplement plan, those are the plan N and G, the one you're paying a monthly premium for. You also have a standalone prescription drug plan, and if you don't, you better, because if you don't have it, you're going to get a penalty once you sign up for that. But you also have a standalone prescription drug plan, and quite often those are two different companies. And because you are a member of that prescription drug plan, they probably have Medicare Advantage plans. So normally these companies are not allowed to contact you legally, even though they do all the time. And Medicare insurance agents harass you, 24/7, but they're not supposed to contact you. But if you're a member, they can. So if you have a Medicare supplement plan, sometimes you get stuff in the mail and you get calls and stuff, and it's from your Part D plan, and they say, "Hey, yeah, how's everything's in? Oh, by the way, did we tell you we just have this new plan in your area and it's got free dental and vision and free unicorns and ice cream for life and all that kind of stuff?" What they're trying to do is trying to switch you from a Medicare supplement plan to a Medicare Advantage plan. Don't take the bait unless you want to switch to a Medicare Advantage plan, and if it's but just kind of be aware that that's what happens out there. But again, because all of these companies make more money with a Medicare Advantage plan than they do Medicare supplement plans. And you're like, how is that possible? Would a Medicare supplement plan cost a monthly premium and a Medicare Advantage plan is zero premium? Yeah, because Medicare Advantage plans, they're using your money that you paid into for decades. So that's why, and then they, prior authorizations, and they deny this, and network that. And so that's how they make their money. So Lori, can I file Social Security retirement under my ex-spouse and my own? We were married 20 years. He is already receiving benefits, but I haven't started yet. He is 77. I am 64. Yes, absolutely. So you have to do both. So you have to file for benefits on your record first. And then if your ex-spouse's benefit amount, the full benefit amount is less than half of yours, or excuse me, if yours is less than half of his, then you're entitled to that difference. One offsets the other, and because you're going to be taking those benefits early, they're reduced. But yes, you file for benefits on your record, and then as part of the process, if you talk to a Social Security employee and they're over the phone and do that, then they ask you, were you ever married to anybody for 10 years or longer, or married to anybody that passed away after 9 months? And then you tell them yes, and then they look for that person's. If you don't have the Social Security number, no big deal. They can find it. They'll look at that person's PIA, their primary insurance amount, and if the calculations work, then you'll get that extra money. And it doesn't matter if he is filed or not. So this is called independently entitled divorced spouse. If your ex was, let's say he's 62 years old and he hasn't filed yet, doesn't matter. You can still file for benefits on his record. Again, you have to file for benefits on your own first, but you can file for benefits on his record even if he hasn't filed yet. It's called independently entitled divorced spouse. You just have to been married to the person for 10 years. That person has to be at least 62 years old, and you have to be divorced for 2 years. And that's only for the independently entitled divorced spouse. All the regular stuff is not applicable. When Real ID becomes effective May 7th, will there be an issue to get into Social Security building without Real ID? No, and none of that Real ID, no relevance really to Social Security. They don't check IDs when you go in, to get into the building. So that's not an issue. When you're, doing a claim and stuff like that, they, check. But anything more we can do to save Social Security and Medicare? My 2 senators and 1 rep has spoken out in Congress, so it's preaching to the choir with them. What more can we do as regular citizens? Yeah, social media, share all that kind of good stuff. The new website I'm working on now is going to have a thing where a little script that you can contact your politicians, and it's usually if you live in a particular state and all of your representatives support it, then there's not a lot you can do except for contact your relatives in other states that those politicians don't support Social Security, and then, convince them to, contact them. Everyone needs to come together and stop this decimation of our Social Security system. Unfortunately, the Trump is doing exactly opposite what they ran on. Please wake up, everyone. Yeah, and again, this is not just the Trump administration. He's definitely putting this on steroids. Putting Elon Musk and Doge in charge. They're definitely chopping it down and gutting it. But this has been a long time coming. Biden didn't do what was necessary. The previous Trump administration didn't do what was necessary. Clinton didn't do what was Obama. I hold them all accountable. If they had done their job, then the computer system would be updated. Social Security would have enough employees to help people out, make sure you're getting all your benefits. I wouldn't have to be here. I could actually retire, and the cuts wouldn't be happening in the future. And because politicians didn't do what they're supposed to do, all of those things, and unfortunately, you're stuck with me. Health is a choice. Health insurance of any type is worthless if it won't pay for the natural cures that the people choose, where he can find the doctors we want and not be dictated to by murderous sorcerers of the AMA. All right. Yeah. So it might be RFK Jr. might be your guy then. He is, yeah, all about natural everything, I guess, right? David, people are all their pads themselves pockets like most all politics now. It's corrupt as it gets. Yeah. Let's see. Yes, just got my Part B paid for, thank God. But must renew every year. Yes. Okay, so you applied for Medicaid and you got the higher levels of Medicaid, and now they're paying for your Part B, the $185. Now that's putting $185 back in your pocket, which is a beautiful thing. But yeah, because it's a welfare-based program, yeah, you must renew it every year. They just check to make sure you didn't, win $1 billion in the lottery or $1 million inheritance and stuff like that. See if you're still eligible for that. But remember, if now that you have Medicaid and Medicare, you're dual eligible. So you might be eligible for one of those upgraded Medicare Advantage plan, the Medicare Advantage dual eligible plan. So yeah, definitely. Again, you can reach out to Chapter once they're open again in a few days. Oh, Anastasia, peace and love. Thank you. I got a lot of questions that popped up, and unfortunately, I when I get tons of questions, the earlier ones just disappear. So I apologize if I'm not getting to your question. My Part B is paid for under Medicaid, called Extra Benefits. Have had that since retired some years back. Perfect. Yeah. So we just want to make sure people that are, that's $185. That's the difference between electricity and low electricity for a lot of people. So if they lose that because Medicaid is cut back under the guise of fraud, waste, and abuse, that's the key thing everybody's doing is, hey, we can do whatever we want if we call it fraud, waste, and abuse. So, someone became a silver member. Alvaro Guevara, thank you very much for becoming a member. Yeah, that definitely helps out. This is a 2-man operation. My son and I that do all this every day, and he makes sure the technology works sometimes, but I still mess it up anyway. So thank you very much. I appreciate it. Was going to finish my master's degree with 3 courses left. Financial aid will take their money for the courses, and the rest will be sent back as a check to me. Will this be seen as income? It depends what we're talking about. Income. If you're receiving retirement benefits, no. If you're receiving SSDI, no. If you're receiving spouse benefits, no. If you're receiving survivor benefits, no. If you're receiving any type of welfare-based program, Medicaid, SSI, or something like that, just might. It just might. So, but then you just tell them, hey, this is a refund or something like that, and then they should be able to address it. So. Bella, Florida Medicaid food stamps makes people work. I think DeSantis put that in law. Yeah, some states, when I worked, before I worked for Social Security Administration, I worked for the Department of Social Services. And they had people that, in the state I worked in, they made you work. And again, a vast majority of people on Medicaid already work. So, I mean, and it's not a forced type thing. They just work, but where they work, they just don't make enough to pay for health care. And so that's why they sign up for Medicaid. So what about Congress and the new bill that cuts $880 million out of Medicaid? Do you know what's happening with that? They've been talking about that, and they're still trying. They're still trying. So again, they use it as, this is fraud, waste, and abuse. The $880 million or whatever is just fraud, waste, and abuse. But throw the baby out with the bathwater. I've heard, hey, Linda, I've heard that too, that if you draw a pension, they're going to take your Social Security. They're not taking my Social Security. I work for that. I work for my pension. There was the only time a pension affects your Social Security, it no longer affects it, but it affected it up until Biden signed the Social Security Fairness Act, are those people that worked under a government, state, local, federal um, uh, programs that did not pay into Social Security. The federal government has been paying Social Security since the early 1980s, but there are still Texas, teachers and different places that don't pay into Social Security. They don't contribute to Social Security, and so um, prior to a few months ago, that pension recalculated their benefits, but that no longer anymore. So yeah, a pension does not affect your Social Security benefits. Nobody now at all. Period. Full stop. My husband is a vet, and the VA for all care received a letter from Social Security will be taking out for Part B $185. Since he goes to the VA for all his care, does he have to sign up for Medicare Part B? Okay. So if he's you said VA, so it's probably not TRICARE. If you're TRICARE, that means he's retired from the military. Then TRICARE, then you know you do have to pay for the $185. You do have to pay. They mandate that. If you're talking about like me, I only served 8 years in the Marine Corps, which was equal to 20 years in all other services. But anyway, so I'm not eligible for like TRICARE, but I could be eligible. I'm not, but for VA Veterans, Administration, working, going to the clinics and stuff. So, all right. So that's a question I get all the time. Should you pay the $185 when you're happy with the VA? And there's some veterans that say, hey, I'm happy with the VA, good customer service, it's close by, no issue, da, 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 da. And so they don't sign up for Part B. And they get all their health care from the VA. But if they move, they need a second opinion. The VA's under attack too. They're talking about getting rid of 83,000 people that work at the VA clinics and stuff. And so maybe your husband loves the VA now, but what's going to happen next year? So what I recommend is keep that into consideration. So if a VA is always going to treat you well, then don't get Part B if you don't want it. But if you decide you change your mind later, you can only sign up during January, February, March, and then you're also going to get a penalty, a 10% penalty for every 12 months you waited. And that's for life. So here's a trick. So here's a trick to have your cake and eat it too, is what's called a Medicare Advantage Part B give back. And a Medicare Advantage Part B give back is you have Part A, you sign up for Part B, you pay the $185, but then you sign up for one of these Medicare Advantage Part B give backs, and it really depends, how good the one is available in your area, but they pay for part of your Part B. So you get all of that, coverage just in case, but you're not having to pay the full $185. Maybe the Medicare Advantage plan pays $50 of it, $100, or maybe the entire $185, depending on your particular area. So that is a good trick to, and again, a chapter can help you out and go over all the options with your husband and say, okay, in your particular area, hey, there's one that that pays $185 of your Medicare. And that way, he's covered across the board. So let's see. Computer, $1.99. Thank you very much. I appreciate it. Let's see. I agree, Bella. We need to keep a close eye on nursing homes as they are the first place to start skimming. Yes, that is a fact. The least vulnerable are always the people that get hurt the worst, and obviously they can't take it. Like with all the changes to Social Security, all the gutting of Social Security employees and all that. If you've got money in the bank, or if your father-in-law or your was it son-in-law is a billionaire, then like the Commerce Secretary, then they can they can float you for a couple of months if you don't get your Social Security check. But for those millions and millions and millions of people out there that depend on their Social Security on a monthly basis, if something happens and they can't get into a Social Security office, they can't get help from a Social Security office, they're going to go without a check for a month or 2 months. So yeah, cutting back it just hurts the people that really can't take it. G plan in California is costly, by the way, but MA is repugnant. Okay, yeah. Yeah, in some states, you should check out New York. Medicare supplement plans are crazy expensive in New York. That's because New York does it right. And if every state did it like New York, then it would be a lot better. So New York basically makes it, because the Medicare supplement plans, whether they're available or not, depends on your state law. It's not a federal law. So in New York, they say, hey, you can Medicare supplement plans. You cannot discriminate against any health people with health pre-existing conditions. Yeah, in America, we're the only country that calls that pre-existing conditions, and every other country it's called your health record. So anyway, but yeah, New York says, yeah, you can't discriminate against people that are actually sick to sign them up. Um, because because not all the other states do things like that. Most of the other states don't do it like that. Then that's why New York is so expensive. If everybody did it right, then yeah, it would be a lot better. But unfortunately, Wild Bill. If we had a universal healthcare system, we'd have a healthcare card like a Social Security card. If only we'd eliminate the FICA cap and maybe tax the morbidly rich. The morbidly rich, they're fixed it. Yeah, exactly. What's funny? There is no cap on Medicare. So if you're making, $100 million or $200 million, then you're paying FICA Medicare on every dollar you make. But you know what happens with the super rich? They don't get regular wages and stuff, so they get stock options, and those aren't yeah. So let's see here. Can you please explain why Chapter and other agents are free? Yeah, absolutely. They get paid by just like all other Medicare insurance agents and Affordable Care Act and all that. They get paid by the insurance company. So, but the great thing about Chapter is the people that help you, the actual advisors that help you. It doesn't matter, what company you choose. What they do is they if you're looking for a Medicare, supplement plan, they look for those. If you're looking for a Medicare Advantage plan, they go, check your doctors and your prescriptions and see what you need. And then they give you your options, and whatever you sign up for, doesn't matter to them. They enroll you in it. And then that company pays those people a commission. So it doesn't matter which one you sign up for. That's why it's different than agents. Kind of captive agents. Captive agents are agents, Medicare insurance agents, or any type of insurance agents that work for a particular company. So if you contact a captive agent that works for Medicare company ABC, guess what company they're going to recommend? Company ABC, because that's the one they make their money from. So that's why I always recommend a broker, and Medicare and Chapter or brokers. They don't care which one you sign up for. Whichever one is the best for you, that's the one they help you sign up with. So yeah. Let's see here. I am confused as to why folks are thinking that a no tax on Social Security is coming. I'm 76, been on Social Security a long time. I have never had my Social Security taxed. So what's up with that? Yes, Freddie. Yeah, I agree with you, Freddie. It's crazy. The people that are so adamant about, they're so gung ho about, I'm not going to get my Social Security, benefits. My Social Security check won't be taxed. And then I say, well, about how much do you make per year? Oh, I just get this and I work a little bit. Well, your Social Security benefits are not taxed anyway. So about 50% of people don't pay taxes on their Social Security benefits. And those are the people that are really gung ho about not having their Social Security benefits taxed. And it's like, they don't even have to pay it. And it actually works against them. So if they stop taxing Social Security benefits and the other, let's say 50%, stop paying Social Security taxes, then that is going to deplete the trust fund sooner. Right. So the trust fund is going to be running out here in about 9 years or so, 8 or 9 years, even sooner, possibly. Depends on what happens now the economy is in the tank. But the trust fund is being depleted. And part of that trust fund is being replenished by taxes on Social Security benefits, and about $60 billion a year. So when they take out that $60 billion a year because no taxes on Social Security, that means the trust fund gets depleted sooner and people get a larger cut sooner. Now it's about 21, 22%. If they don't tax Social Security, it's probably going to be 3 or 4 or 5% more. So the people that are really like Freddie there, if they don't if they stop taxing Social Security benefits, Freddie's going to get a cut in his Social Security check sooner. Yeah, so it's crazy. People just don't look at all the, but Freddie does. So, would like to know more about Ozempic or drugs for weight loss. Um, yeah, reach out to whatever doctor, and they're looking about changing that now that it's not going to be covered. I saw that in the news recently. Not sure where they've fully decided to switch that. That was a policy that Biden started, and then he said, weight loss, Ozempic, and everything, that they're going to cover that. But it looks as though anything that Biden did, they're trying to switch it back. So, all right. Dad had an F, and it's outrageous in cost. All told, $535 a month. It did pay out $300,000 last year with zero out of pocket, though. Is an N as good as this? No, an F was the gold one. That there's 6 gaps in original Medicare, Part A and Part B. You've got, deductibles and co-insurance and, all this kind of stuff. F covered all 6 of those financial gaps. A Plan G covers 5 of those. And the only one it doesn't cover is the Part B deductible, which is $257 a month, or excuse me, $257 a year. Plan N covers so if, let's say, so a Plan N is usually cheaper than, it's definitely cheaper than F, usually cheaper than a G, about 20% cheaper than a G. And it's, you still have to pay your $257 deductible. And then you might have to pay $20 to $50 for going to a doctor or going to emergency room unless you're admitted. And then there's things called excess charges, which most people don't even pay. That's why I prefer N, because I'm cheap like that. So I always recommend N, but N or a G are perfect. But the problem with your dad is if he has F, he probably tough or not impossible to switch to a G or an N. If he's healthy, he might be able to do it. You can reach out to Chapter and see. But yeah, and the reason F is going up so much is because that nobody can enroll in F anymore. So the pool of people in F is getting smaller and smaller and smaller and sicker and sicker and sicker and older and older and older. So one day there's going to be, 2 people in F, and their premiums are going to be, $6 million a month. Now, anyway, I think there's a limit, but you get what I mean. Pamela, I was married for 11 years, then divorced. Then I got remarried for 5 years. Can I file on my first spouse? I get SSI now. If you get SSI, the welfare-based program, then you have to file. If you're eligible for any other benefits, then you have to file. I'm surprised SSI hasn't reached out to you. You probably mean Social Security. What you probably mean is I get SSA now. Okay, you get Social Security now. So yes, you got remarried for 5 years. It sounds like you're now divorced. So if you're not divorced, absolutely, you can go back to that previous marriage. You can't go back to your recent 5 years because you were only married 5 years, but you can go back to your previous 10-year one. So as long as that person is at least 62 years old, then yes, you can file for benefits. So call Social Security, give them that person's information. If you don't know the Social Security number of your first husband, no problem. Just, give them call Social Security, the 800 number, wherever, and give them that person's first name, the date of birth, as well as you remember it, wherever they were born, as well as you remember it. And they will be able to find the Social Security number, and they'll see if there's any more money for you. And if there's more money there, then they'll set you up an appointment and you can get their money. Sue, how will it affect my SSDI if I take out of the total amount of my total IRA? Won't affect your SSDI at all. No relevance whatsoever. So you can take out that $1 billion you have in your IRA and buy me a beer. No relevance. If SSDI, because it's not earned income. If it's SSI, the welfare-based program, then it does. But you said SSDI, so yep. Your 401k just became 201k. Oh gosh. Yeah, I was taking claims when I worked at Social Security. I was a Title II CS, Title II claim specialist. I help people with retirement, Medicare, survivor benefits, SSDI. And I was taking claims, processing claims in 2008, 2007, 2008, 2009. And people, yeah, it was terrible. People came up and said, yeah, I have to retire. I'm getting old. I had a 401k. Now I have a 201k. And so Walmart, here it comes. Yeah. So, yeah, that was tough. And so I guess it's, I always try to be positive. This is the same time that a lot of people, they're attacking Social Security, talking about all these dead people and talking about, blaming immigrants for everything. And they're attacking Social Security with the ultimate mission of privatizing, saying, hey, Social Security is so corrupt and it's useless and it's a piece of, whatever. And then we just need to get rid of it. And how do we do that? We give all that money to Wall Street and, they're, and the rich people. And that's what they're trying to do right now by cutting it and doing all this other crazy stuff under the guise of fraud, waste, and abuse, even though they haven't found any fraud, waste, and abuse in Social Security. People always say, Ed, you're delusional. There is fraud, waste, and abuse in Social Security. Of course there is. In my office, I found a whole bunch of it. But Elon Musk and Doge hasn't found one penny yet, right? So, yeah, because they're looking at the wrong places. They're looking for, a big $1 billion fraud, waste, and abuse. And that's not how Social Security, fraud, waste, and abuse is $5,000 here, $10,000 there, $20,000 there. Yeah, that's that type of fraud, waste, and abuse, no interest to someone that's worth, $500 billion. So, but yeah, it's tough out there for those people that are losing all that money. And now it's even more important that they get the right benefits from Social Security. So the economy tanking right now is terrible for everybody, but at least possibly that will stop the attempt to privatize Social Security, because people will say, the politicians and the billionaires will say, hey, just give us all the Social Security money, the trust fund, and we'll make you a whole bunch of money. And then at this particular time, we can say, oh, like you're doing now. So hopefully there's a benefit in there. I know it's not any consolation to those people that just turned into a 201k, but yeah. I have an advantage with a PPO, the referral, no prior authorizations, and 3,500 Flex MasterCard to use for my $39 copays to a specialist, $180 for MRI, CAT scan, PET scan, all my meds. Awesome. Yep. So it sounds like you picked a good plan. Remember, those change every single year. So a lot of times, they give you all this awesome stuff to sign you up, and then that plan that you have right now is that plan until December 31st. And so right now it's a Ferrari or a Corvette, but January 1st, it could be a Ford Pinto or a Corvair or, whatever. So you have to check that every year. That's the thing about Medicare Advantage plans. With a Medicare supplement plan this year is the same as next year, the premium might change, but the coverage is exactly the same. Medicare Advantage, they change every single year. Dr. Ed, both parents on Social Security. Dad had a stroke, has PERS, and waiting for adjudication on Social Security check. Is there an income limit on getting Medicaid to pay for Part B for two of them? Yeah, there's an income limit, absolutely. And so if you're on PERS in Nevada, or maybe California, so. But anyway, but if you're on PERS, that means you're getting a pension from someplace. And unless that pension is really, really small, with a PERS pension, and now your Social Security benefits are increased because of the Social Security Fairness Act, and then you've got two people. So I'm just kind of, reading in between the lines there. But yeah, always check out. That's their job. At the Medicaid office, at Medicare, at Social Security, their job is to tell you whether you're entitled to those benefits. And I'm coming up with a website now that will help you and, get you started. So make sure you subscribe, so I keep you up to date on that. Hopefully within the next few weeks, it'll be up and out. I think it's going to be the best website in America, but it's going to have so many calculators and tools and stuff. So it's going to be awesome. But I work for a Medicaid Supplement Advantage insurance company in Denver. Hmm. Not sure what a Medicaid supplement. I've never heard of a Medicaid supplement. Do you mean a Medicare supplement? And they were able to be defaulted to people signing up for Medicaid. They did not notify all new Medicaid recipients of this. Yeah, I'm not sure. I'm not sure what you're talking about there. Never heard of a Medicaid supplement plan. I'm on Social Security and don't need to file federal taxes. A lot of people don't realize that. I think I still have in my YouTube description, I've got a link down there whether you actually have to file taxes. Um, IRS has a website, a little tool, a pretty cool little tool where it's you answer like 6 or 7 questions, and it'll tell you whether you even have to file taxes. And Sonia knows federal taxes. Even if you don't have to file federal taxes, sometime you still have to file state taxes. So I live with my son. He pays for half of my living cost. If he claims me as a dependent, will my Social Security check change because of the total household income? Um, it depends what type of Social Security check you get. If you get SSI, you have to notify SSI. Call your your Title 16, the local Social Security office. Talk to a Title 16 claim specialist, the SSI people, and then talk to them about living arrangements and all that kind of stuff. But if you're receiving a retirement check or Social Security disability insurance or survivor benefits or spouse benefits, then nope, no relevance whatsoever. All healthcare, keep smiling. What's up? Keep smiling. All healthcare should include dental, hearing, but not for cosmetic procedures. Come on, not even male pattern baldness. I always say if I become dictator for a day, I'm going to make universal healthcare, for everybody right after the cure for male pattern baldness. So sorry, I have my priorities. I told my Advantage it ends up costing insurance more when an infection in the mouth and bone infection spread. 100%. Yes. Oh, and that's one of the things I would do with universal Medicare would be it should also include dental, vision, and hearing. And that was kind of the deal with, I guess, with the devil at the crossroads when, they started those Medicare Advantage plans. They were talking about, Congress was talking about adding dental, vision, and hearing to original Medicare, which I agree. How healthy are you in retirement if you can't hear, eat, or, speak, yeah. But the deal when Medicare Advantage plans first came out, that was their kind of calling card, their selling point is, hey, don't stay with original Medicare, come over to us because we have dental and vision and hearing. And so, yeah, we were kind of, yeah, we were kind of ripped off there, weren't we? But I agree with you. They should definitely have it. Janet, they cut Medicaid. My grandson received a letter that they no longer have coverage when we called. The man said, I can't talk about it with all the changes, but they raised the threshold. Yeah. I wonder if it's they just raised the threshold because it was the new year. They raised the threshold a little bit every year. So if he lost Medicaid and he also had Medicare, then he also lost his Medicare Advantage dual eligible plan, and he needs to find a new one before his previous one is canceled. So you can reach out to Chapter there, but yeah, and they're talking about there are 9 states that automatically, if Medicaid, if the states get less money from Medicaid, then there are 9 states that automatically will kind of end that Medicare expansion, and a lot of people will lose their Medicaid. And it's interesting. It's the red states, the states that vote for that party, and they're the first ones that are going to suffer. So, but yeah, but Janet, mistakes happen. So if you disagree with that determination that he is no longer eligible, file an appeal. And sometimes there's exceptions where they say, okay, yeah, you have X amount of income and it's $1 over. Oh, but this type of income that you've got this $50 here, that's exempt. So, there's things like that. So definitely check it out. You might be, yeah, it might be good, but always appeal those type of decisions. Ed, can you please go over child and care benefits? Bernschwag. Absolutely. So if you have someone that is receiving retirement benefits or disability benefits or someone that passes away, and you have children under the age of 16 or that became disabled before the age of 22, then let's say you have a child that's 12 years old and their parent is receiving retirement disability benefits or passed away. So the child is receiving Social Security benefits. So, and this is the politicians. There's one from Oklahoma that shall be governed nameless, that said Social Security, we should not pay Social Security to people that never worked. Okay, well, this 12-year-old is not going to get any benefits because he's never worked. But anyway, so the guy doesn't know what Social Security is all about. So this 12-year-old is receiving Social Security benefits. If the other parent, let's say the mother, is staying home or substantially limiting their income to take care, child in care, to take care of that child under the age of 16 or that became disabled before the age of 22, then that other parent can receive those child and care benefits. So let's say it's only two people, one 11-year-old child and the mother, and the father is receiving retirement disability. So the child receives up to 50%, probably in this case, 50% of the parent's full benefit amount. So the child receives 50%, and then there's a family max, a maximum that can be paid out on a record. But if it's only two people, then the other parent will receive the same amount of check as the child. And the parent will receive that child and care benefits until the child reaches 16 years old, unless the child became disabled before the age of 22. And that's child care benefits. And the 50% switches to 75% as a surviving child in care. In a surviving a surviving child, a surviving dependent auxiliary child. If the child is receiving 50% and that parent passes away, it switches to 75%. So up to 75%. Depending if there's a whole bunch of kids in the receiving benefits, then it's reduced. I didn't owe taxes last year, or this is it because I'm poor? Yes. Social Security was taxed according to total household income. I paid for years on small amount of Social Security because of spouse income. Yeah, that sounds right. Yeah, so if you're over a certain threshold, and the threshold hasn't changed for decades. That's what's the crazy thing about taxing of Social Security benefits is that that started in the 1980s, and they really haven't increased it. So more and more and more people are being taxed on their Social Security benefits. So yeah. And I agree. I agree with President Trump that Social Security benefits should not be taxed. I mean, you already paid for them taxed them. And so, but again, for 40 or 50% of people don't even pay taxes. So the people that will benefit will be, the other 50% that have other sources of income or stuff. They should have never been taxed, I believe. So I think they should end Social Security taxation. But the problem is now we have to find another $60 billion a year to fill that gap, to fill that hole. If we don't, then yeah. And that's why we should just raise the cap on, if you're a millionaire, you should pay Social Security taxes, FICA taxes, just like all the rest of everybody out there that pays FICA taxes on every dollar they make. So, all right, we're at a couple of minutes away from an hour there. So I always like to keep these to an hour. Let me do a few more questions. Then we'll call it a day. I'm returning to the U.S. on May 25th. Can I go to the Social Security office and discuss her application? Is there a form of notarized letter I would need? Will my wife qualify for Medicare? Okay, I'm not sure to discuss why isn't she here in the United States to talk about her application. There is not a notarized letter or something like that. You can become the representative payee for your wife. If your wife is not able to take care of her own benefits for some reason, you can be appointed the representative payee and you can speak for her in Social Security. But yeah, Social Security does not recognize power of attorney. Why? Because when you give someone power of attorney, that means you have the ability, your sound mind and body, to give someone power of attorney. Social Security, in that case, Social Security wants you to take care of your own benefits. But if you're not able to take care of your benefits, then you get a doctor's note and stuff, and the doctor says, yes, this person isn't able to take care of their own benefits, and then they get a representative payee. So people used to come down to my office all the time, and all offices throughout the country with power of attorney and says, no, I have power of attorney, Social Security. Well, if this person has the ability to give power of attorney, they can speak for themselves. So bye. I'm living in the Philippines with my wife. Okay, is this the follow? Okay, this is where it explains the other part. We're both U.S. citizens. My wife is a naturalized citizen, only has 10 qualifying quarters. Will she qualify for Medicare? With only 10 quarters? No. But on her own, no. But she is, if she's your wife, then maybe she's eligible for benefits on your record. So even if she is not eligible for Medicare or money on her own record, as your spouse, she's entitled to file for those benefits on your record. So she can get monthly benefits on your record and Medicare on your record. So Medicare automatically enrolling retired FERS employees on Part B, even though it's optional. My husband already has Part A, and we don't want Part B because Medicare will then become primary. Yes. They automatically, if you are on monthly benefits, then once you turn 65, they automatically sign you up. So you just refuse it. So it's no big deal if you don't want it. And nobody's making, the post office, they make you do it. TRICARE, they make you do it. But for you, doesn't sound like it's an issue. Bella became a member, silver member. Thank you, Bella. I appreciate it. You're awesome. All right, let's see. Let's go one more question here at random. Peggy could never understand why people say it's a good thing they are not going to tax Social Security. I tell them most people don't pay on tax of Social Security. The trust fund needs those taxes from those who can pay. There is someone that knows what she's talking about. That is a beautiful thing. Regular viewers to my channel, when they go out into the world and they talk to people about Social Security and Medicare, I'm sure y'all just shake your head and say, "Oh my gosh, these people know what don't know what they're talking about." I just listened to Steve Ram podcast. They have arrested some people for Social Security fraud. Steve said there's a big hug arrest fixing to be arrested. Social Security fraud happens all the time. That's been going on since 1935. My office, we've had several people arrested for Social Security fraud. So it happens. But, is it, millions of deceased people receiving Social Security? Are they arresting those millions, those 20 million people that were deceased getting Social Security benefits? Yeah, no. Can you arrest one or two people? Yeah, happens every day at Social Security. So, yeah. And again, they're going to use that. See, there was fraud, waste, and abuse at Social Security, and see, Social Security is incompetent and don't know what they're doing, and that's why we need to destroy it and give it over to, the Wall Street so they can do what they do best, is rate it and give commissions to the billionaires. So, my sister worked 36 quarters and then became a teacher in California. She is now retired from teaching. Can she go to work, get 6 more quarters for Social Security, and then qualify for the WEP? Well, no, she can't qualify for the WEP because the WEP doesn't exist anymore. But she can qualify. Oh, and thank you for the $9.99. Appreciate it, support. But if she wants to go back to work and get another 4 quarters, so she can get her Social Security benefits. She's already qualified for Medicare. So if she worked for that teaching place, she did pay the Medicare part of FICA, but she didn't pay the Social Security part of FICA. But remember, maybe is she eligible for spouse benefits? If she's eligible for spouse benefits, she's going to get money from there anyway. So if she goes and works and makes a few bucks, doesn't really matter because one is going to offset the other. So definitely check that out. All right, over an hour, and apologize. I got tons of questions. I'm not able to get all of them, but I will be back again tomorrow and answer a whole bunch more after I come up with some type of topic to talk about tomorrow.